The state of Illinois has just become the first state in the nation to require schools to screen every child for mental health problems. Beginning in the 2027-2028 school year, all public schools will give annual mental health screenings to children in grades 3 through 12. Sounds nice, right? Early detection, awareness, caring for kids, except it's one of the most dangerous and stupidest ideas ever put into law. I'll give you 6 good reasons why no other state in the nation has decided to do this. Reason number 1, it won't work. The main problem is false positives. These surveys are self-reports, which are notoriously unreliable. The questions are too misleading and lack appropriate context. Normative unhappiness is not the same as a mental disorder with functional impairment, but nobody told the survey takers. For example, I conducted the only analysis of how accurately children and adolescents self-report trauma events. We found that 79% of so-called trauma events children reported on paper weren't traumas at all when verified in interviews. 79%. This type of inaccuracy undoubtedly extends to anxiety and depression symptoms. Reason number 2, it teaches children that they're fragile. Every year, children from 3rd grade on will be told to fill out surveys to monitor their mental health, like ticking time bombs waiting to explode. This can be insidious. It trains children to think that they must be fragile, or else adults wouldn't be giving them surveys over and over. Actually, I don't think it has that effect on all children. I think it may have that effect only on a subgroup of neurotic and anxious children. Reason number 3, it's not the role of schools. Since when did schools take over the role of parents?
Most of y'all parents are dumber than you. I'm going to say that out loud. My parents are freaking dumb.
If a parent is concerned about their child's mental health, they should go get their own evaluation, right? Not wait for the school's annual screening. This is part of a larger problem, schools encroaching on what should be parents' responsibilities. We've already seen teachers promote liberal progressive ideology about anti-white racism and transgenderism behind the backs of parents. We've seen how that works out. Most parents are sick of it. Activist teachers have no business insinuating themselves between parents and their children. Reason number 4, it will violate privacy. Who's handling all this sensitive information? Doctors are bound by federal HIPAA privacy laws. Teachers are not. Even with HIPAA law, medical employees still snoop in patient records. Doctors and nurses who work at large hospitals know this risk, and they will refuse to obtain their mental health care at their home institutions a lot of the time because they know employees snoop in their electronic records. I've seen this many times. Instead, they will go to outside clinics to protect their privacy. Children in schools won't have that option. A perfect example is when Britney Spears was in a psychiatric hospital. Multiple employees illegally snooped in her record. Yes, that will happen to these children. Reason number 5, it's built on a false premise. Have you heard that there's a youth mental health crisis? Of course you have. It's plastered everywhere. Well, that's the driving force behind this screening program. But that's actually controversial. While psychologist Jonathan Haidt has become famous with a best-selling book promoting the idea of crisis, many other psychologists and psychiatrists, including myself, have pointed out numerous flaws in Haidt's claims. Haidt is not a clinical psychologist. He's an academic social psychologist. If you were to believe Haidt, 1 in 4 teen girls suffer from major depression disorder. That's simply inconceivable to anyone who actually knows what major depression looks like and spends any time around children and adolescents.
We're probably in the midst of another moral panic.
Reason number 6, the treatment capacity doesn't exist. Illinois already has a smaller screening program outside of schools, and an investigative report found it can't even connect kids to care that are being identified now. So they're going to multiply that system overload with universal school screens, referring thousands of mostly non-disordered kids to therapists? It sounds delusional. It's like the politicians are trying to create a fake crisis of children who can't receive care. In summary, universal mental health screening in schools is not about helping kids. The same ideology that brought critical race theory, DEI, and gender politics into classrooms now wants to train children to see themselves as fragile patients of the state. If you notice, this is only being done in one of the most liberal states in the nation. And because this initiative sounds like compassion and care on the surface, it might be even more dangerous than those other projects because it's harder to notice the manipulation when it's disguised as care. And that is why this is one of the dumbest educational policies in America today.